Hello everyone, my name is Dr. Ababnه, and today's topic is about diabetes mellitus. The main objectives of this presentation is expected that students will be able to number one, review the anatomy and physiology of pancreatic gland, number two, classify the main types of diabetes mellitus, discuss the pathophysiology and clinical manifestations of type 1 and type 2 diabetes mellitus, and finally recognize diabetes mellitus diagnosis. At the beginning, I would start to explain the anatomy and physiology of the pancreatic gland. The reason I am going to talk about this because any malfunction or any metabolic changes related to the physiology of the pancreatic gland, this can be the main leading cause of diabetes mellitus. So it's really important to understand anatomy and physiology of pancreas before going further and exploring diabetes mellitus. So pancreatic gland is a soft and lobulated gland which is located on the upper left quadrant of the abdominal cavity. Pancreas has three main parts, which is the head, body, and tail of the pancreas. Pancreas is located behind the stomach, and pancreas has two main functions. The endocrine part, which is mainly producing hormones such as insulin, glucagon, and somatostatin, and the exocrine part, which is mainly producing pancreatic juice that goes to the digestive system and helps in digestion process. Let me here differentiate between the meaning between endocrine and exocrine. Endocrine means that when the gland produces its chemicals directly to the bloodstreams, we call this endocrine function. For instance, here pancreas produces hormone such as insulin, which goes directly to the blood. So this represents the endocrine function. While exocrine means that when the gland produces its substances to other organs, in this case to the digestive system, specifically the duodenum here. So this is an exocrine function. For instance, here pancreas produces the pancreatic juice, which has digestive enzymes such as bicarbonate. This enzyme helps in pH balance in the GI tract, particularly duodenum, because usually we have low pH due to the high acidity from the peptic acid in the stomach. I don't want to go a lot of details here because this should be as a part of the digestive system, while in this lecture I need to focus more on the endocrine functions of the pancreas. The main physiological function of pancreatic gland is blood glucose regulation. If you look to the microscopic level of the pancreas anatomy, we can see that we have three main types of cells. Number one, we have alpha cells, which mainly produce glucagon, beta cells, which mainly produce insulin, and delta cells, which produce somatostatin. Let me here explain the function of each hormone. I would start to explain at the beginning the function of insulin. Look at this figure here. In human body, when we eat the meals, let's suppose here three main meals, which is breakfast, lunch, and dinner, we have significant rising in blood glucose as a result of these meals. So we don't want this high rising of blood glucose in the blood because it can be harmful. It can cause inflammation. As a result, it can cause complications. So usually a human body has like normal blood glucose level. So we need to keep this blood glucose level in the normal range. Also, we need the body to use this glucose as a main source of energy. So in this instance here, when we have high blood glucose, so the pancreas produces insulin, which mainly acts as a messenger that notifies blood cells to use this blood glucose as a main source of energy. Also, insulin helps in a process what we call it glycogenesis, which what we mean by this is converting the extra glucose and storing it in the liver as a main source of energy, as a form of glycogen. So simply, let's here simplify this here. When we have blood glucose in the blood, extra blood glucose in the blood after the meals, insulin mainly helps in notifying the cells to use this blood glucose as a main source of energy. Also, insulin helps in storing the extra glucose as a glycogen in the liver and skeletal muscles. Also, in some instances, insulin helps in storing the glucose as fats. We call this lipogenesis. This is the main function of insulin. Glucagon, on the other hand, acts against insulin. For instance, when we have low blood glucose, especially when fasting, in this instance, cells need glucose as a main source of energy. We don't want to use the stored lipids in the blood, in the adipose tissue. So the body needs to use a more simple form of glucose as a source of energy. In this case, glycogen mainly, or glucagon, sorry, mainly acts as activate the process of glycogenolysis, which is mainly converting the stored glycogen from the liver and skeletal muscles to be in more simple form, which is glucose, and can then simply use as a source of energy by the cells when we have insufficient glucose in the blood. So simply, let's say I simplify the things. Insulin mainly acts when we have high blood glucose. Then the cells can use this glucose as energy, while glucagon acts when we have low blood glucose, which mainly helps in glycogenolysis, then converting the glycogen and to be in more simple form, which is a glucose. Then the cells can use it as a source of energy in case we have insufficient blood glucose, specifically in fasting periods. We have another hormone here, which is somatostatin. And somatostatin is mainly a growth hormone, but it has another function, which is helping the balance of between the glucagon and insulin. Now here, let's focus more to understand diabetes mellitus. Diabetes mellitus describes a group of metabolic disease in which the person has high blood sugar. And this can be for two main reasons. Number one, when we don't have enough production, or when we don't have, when we have absence of insulin in the blood. And in this case, we have what we call type 1 diabetes. Type 1 diabetes means that we don't have insulin. We have absence of insulin. While sometimes we have insulin, but the cells don't respond probably to this insulin. And we call this insulin resistance, that cells resist the function of or resist the message of insulin, and in this case we have type 2 diabetes. So type 2 diabetes, usually we have insulin, but the cells don't respond to this insulin. In some advanced cases of diabetes, we have sometimes inadequate or absence of insulin, but it's well known that type 2 diabetes, we have insulin, but the cells don't resist the function of insulin. So let's here simplify the things. Type 1 diabetes, in case we don't have insulin, complete absence of insulin. Type 2 diabetes, in case we have insulin but the body cells resist the role of insulin to notify the cells to use this glucose, the available glucose, sorry, as a main source of energy. Let me here show you the main signs and symptoms of diabetes. When usually patients come to you and tell you symptoms such as polyuria, which is frequent urination, polydipsia, which is increased thirst sensation, polyphagia, which is feeling always hunger, fatigue, weight loss, and sometimes some patients complain of peripheral neuropathic symptoms, such as some patients feel burning sensation in their feet, numbness sensation in their feet. These can be symptoms of having diabetes mellitus. Now here let's focus more to understand type 1 diabetes mellitus. Type 1 diabetes mellitus, as I said, we have complete insufficiency or complete absence of insulin in the blood. So when patients with type 1 diabetes come to the diabetologist or endocrinologist, so the diabetologist has at the beginning to start the treatment by giving patients insulin. So that's why we call this type of diabetes insulin dependent diabetes mellitus, IDDM, because it mainly depends on insulin. And type 1 diabetes mellitus is not that common. It's less than 10% of diabetes cases, and it usually occurs in early adulthood, usually before age of 40 years old. As I said, we don't have insulin, and this mainly because of failure of pancreas gland. In this slide here, I'm talking about pathophysiology of type 1 diabetes. So what we know now that the reason of this malfunction of pancreas is believed that it's related to autoimmune response, that beta cells in the immune system producing specific antibodies that acts the pancreatic cells and then cause destroying of these cells, then complete malfunction or failure of the pancreas. However, we don't know specifically why this autoimmune response is happening. It's unknown until now why this autoimmune response is happening. So, however, some studies showed that type 1 can be inherited. Some cases were reported to be inherited from their parents. Also, some environmental factors such as getting some bacterial or viral infections or the impact of ethnicity factor have been shown to be associated with developing type 1 diabetes mellitus. But in general, it's not known why some people develop this kind of diabetes mellitus. What I really want you guys to know that or to understand that in type 1 diabetes mellitus we have completely absence of insulin due to failure of pancreas gland. Type 2 diabetes, on the other hand, is non-insulin dependent diabetes mellitus. When people with type 2 diabetes come to the physician or to the diabetologist, usually the diabetologist start giving those patients medications such as metformin, sulfonylurea, or TZDs that can help in increasing insulin sensitivity. I'm not going to talk in details about medications because this will be another lecture. But here I want now to understand that in type 2 diabetes, it's non-insulin dependent. We usually start giving patients medication, and the reason of this, because as I explained previously, that patients with type 2 diabetes mellitus may have a sufficient amount of insulin, but the main issue is insulin resistant. So insulin resistance. So we want to solve the issue of insulin resistance in order to control type 2 diabetes. So on type 2 diabetes, as I said, yeah, insulin resistance. Or some in advanced cases we have insulin deficiency, and it's usually characterized by high blood glucose. And the main etiological factors or the main reasons of developing type 2 diabetes is number one, it can be inherited genetic factors. We can notice in real life that some families they have diabetes mellitus, while other families they don't have diabetes mellitus. So genetic factor is strong factor that can increase the risk of having diabetes mellitus. Ethnicity. Let here give you an example. For instance, one study in the United States showed that people with from Latino Americans origins have significantly higher diabetes in comparison with the Black Americans. Another example from our region in the Middle East, a lot of research showed that, for instance, Jordan, Saudi Arabia, Iraq, Kuwait, all these Middle East countries reported the highest prevalence of diabetes globally. So race can play a factor. And finally, and most importantly, overweight or obese people are much more high risk to develop diabetes mellitus, and I will explain this in the next slides. Also, we have the age factor. Elderly people are more likely to get diabetes mellitus type 2 in comparison with young people. Thanks a lot.